sooner we start there because we've got a conference, so we won't have a lot of money.
Oh, okay.
We'll get through our opening statements.
Oh, okay. Do you mean Republican conference?
Yeah.
Oh, all right. Call the meeting of the Health Subcommittee to order. And today we're having a hearing on HHS's, or the Department of Health and Human Services, actions to identify and address the health effects of the BP oil spill. And I'll recognize myself initially for an opening statement. The purpose of the hearing is to hear basically from the Department about the critical actions it's taking to identify and address the health effects related to the Deepwater Horizon spill. As we all know, that tragedy occurred on April 20th. It's been devastating for the people living in the coastal states and has captured the concern and sympathy of everyone across the nation. There's no question that we have a human health problem, concerns associated with both short-term and long-term exposure to oil. Health experts have warned of health complications such as severe skin irritation, nausea, fatigue, headaches, throat and eye irritation, not to mention the significant depression and anxiety which often accompanies this type of crisis. Studies of people exposed to the Prestige oil spill off the coast of Spain in 2002 showed that they suffered from respiratory complications several years after the exposure. Breathing in volatile organic compounds, including benzene, can cause acute toxicity and could potentially result in serious long-term health effects like cancer, neurological, and reproductive harm. And we also have to ensure rigorous monitoring of dispersants being used to be sure that they have no adverse effects on human health for those workers and volunteers on the front lines of the cleanup. Under the direction of the National Incident Commander, Admiral Thad Allen, and in coordination with the other key federal, state, and local agencies, HHS has worked swiftly to identify and disseminate resources on the ground level. Today we'll hear about the work they're doing on health surveillance, worker training, food safety, and epidemiological studies from the Assistant Secretary for Preparedness and Response, Centers for Disease Control and Prevention, Food and Drug Administration, and the National Institute of Environmental Health Sciences. This discussion should give us a stronger sense of the challenges these agencies are facing, the success they've had so far, and how we can expect HHS to further engage as new information becomes available. I think the crisis requires, as they say, all decks or all hands on deck, and swift information sharing to protect the workers and the community members living near the coastal waters. And I should add that no member of our full Committee of Energy and Commerce has been more committed to this effort than the gentleman from Louisiana, Mr. Melanson, and we have appreciated him keeping us informed of the local perspective. Finally, I want to note that I'm pleased that Secretary Sebelius has contracted a public meeting with the Institute of Medicine in New Orleans next week to convene an independent panel of scientific experts on human health exposure. The information we will glean from that meeting will undoubtedly provide even more expertise to help better execute the recovery effort. And now I'd recognize Mr. Shimkus, who just mentioned that we're here 2 days in a row. I don't know why that's true, but I'm not objecting to it.
Well, thank you, Mr. Chairman. Well, that's good because I have in the audience my legislative assistant's family, Mr. Sarley, they're up front. They can't really figure out what he does for a job, so they decided to come to a hearing to figure that out. And I don't know if once they're done whether they'll walk away thinking he really has a job, but we appreciate you all being here. I'm not going to pick on the health care law today, Chairman. We're just going to move on this hearing and some of the important things that we need to address. I would also say that we're fortunate as a committee to have two Louisianas, and our own Steve Scalise has also been very involved and engaged on the spill and its effect for jobs, the economy, health, and all the things that we've dealt with. So shout out to both those guys. Thank you for this hearing. I'd like to welcome our witnesses and look forward to your testimony. We all know about the event on April 20th, the loss of lives. We had the hearing yesterday with the executives, a massive spill, and now we're focused on capping, recovery, payment, But you're here to talk about long-term effects, or what they would be, and what we know and what we don't know, and how do we get good information. So that's the importance of this hearing. I'm very happy that we have the FDA here today, because, of course, one of the things that we've worked with is on food safety, and we're going to have to watch this closely. We know it's already affecting the livelihood of the folks who use that as their livelihood, and there will be concern, and so where concern is merited and we want to have a safe food supply, we need to protect the consumers. Where there may not be, and we can let these people return in certain areas to their livelihood, we want to do that. So we always focus here, or I always focus on, are using real science, and trying to keep away from the emotionalism that occurs in events, so that we can do our due diligence, and in that way protect public health, but also allow people to do the job that they've done for generations in some areas. So appreciate you being here. Appreciate all the testimony. I look forward to it, and I yield back the balance of my time.
Thank you, Mr. Shimkus. Next is the gentlewoman from California, Ms. Eshu.
Mr. Chairman, thank you for holding this important hearing, and welcome to the witnesses. I'm going to waive reading my spectacular opening statement and save my time for questions. Thank you.
Thank you. And all opening statements can be submitted for the record. Next is the gentleman from Pennsylvania, Mr. Pitts.
Thank you, Mr. Chairman. I'd like to thank the administration for making available to us witnesses from FDA, from NIOSH at CDC, from the National Institute of Environmental Health Services at NIH, and from ASPR. What happened on April 20th on the Deepwater Horizon, the resulting oil spill, is a tragedy, and our thoughts and prayers are with the families and loved ones of the 11 people who died on the rig that day. Lives and livelihoods were destroyed, along with ecosystems, although the environment is not the focus of this particular subcommittee. I'm struck by just how little we know about the long-term and even short-term effects of the oil spill on human health. While there have been oil spills before, none of them match the size and scope of this spill or the particular conditions in which it occurred. We have people coming into contact with the oil, with dispersants, with other chemicals directly, such as the responders and volunteers who are trying to stop the flow of oil and clean up the water and the shorelines. Others are facing psychological trauma as their livelihoods, fishing and tourism and numerous others, have been severely injured or destroyed. And it's possible that if we're not careful, contaminated seafood could sicken or kill people who live hundreds or even thousands of miles away from that Gulf. This is a massive disaster, and the agencies in front of us today are all part of a massive federal response. So I look forward to hearing from our witnesses. And, thank you, and yield back.
Thank you, Mr. Pitts. The gentlewoman from Colorado, Ms. DeGette, and thank you for chairing the hearing yesterday.
Thank you, Mr. Chairman. It was an important hearing, as is this hearing. As President Obama said in his address to the nation last night, this marks the greatest environmental disaster America's ever known. I'm afraid it also has the potential to become one of the worst public health disasters America's ever known if we're not careful. It's been almost 9 years now since the September 11th attacks on the World Trade Center, and we are still seeing repercussions in the form of health effects on first responders and residents who were exposed in the aftermath. The only group for which we have baseline health measures is the firefighters, and we're still, 9 years later, working to cobble together data on impacted populations. We need to learn from our mistakes. We need to establish a registry of workers, volunteers, and residents, capture their baseline health status, and follow that cohort and their offspring over the long term. The gaps in the research on human health effects of oil spills and the use of dispersants are unconscionable. I understand that such gaps exist because there's never been a need for such data, but that's not an excuse for not taking every step possible now to ensure that we collect and monitor relevant data. We also need to make sure of making assumptions, that we don't make assumptions without evidence to back them up. For example, there's a big assumption that because oil on the surface is dangerous and likely to wash up on shore, it's better to use dispersants to push the oil below the water surface. But we do not know what the impact on marine life will be, or whether the combination of oil and dispersants is more toxic than either one alone. And in addition, we need to ensure that the National Institutes of Health has the resources necessary to quickly ramp up research into the health effects of these oil and dispersants. Similarly, we need to ensure that the Food and Drug Administration and the Centers for Disease Control and Prevention have the resources they need to move forward with monitoring the contamination of seafood, as well as for implementing surveillance system and long-term monitoring of the health effects of both workers and residents. I was aghast to learn that although there is a rostering system in place to capture information about workers who may have been exposed to oil and dispersants, we have nothing in place to monitor unofficial volunteers or local residents. And Mr. Chairman, when the Oversight and Investigations Committee was in the Gulf last week, we were horrified to hear from residents that while there is protective equipment on these boats, many of them are being told by BP and its subcontractors not to use the protective equipment for other reasons. If there's one thing we should have learned from September 11th, is that we need to have worker protections and health protections for everybody involved in this cleanup. And we also need to figure out what's happening to the residents and everybody else down there. Otherwise, we're going, as you said, Mr. Chairman, we're going to be seeing health effects for generations to come.
Thank you. You know, if you could just, well, I guess your time is out, but I just wanted to say I remember vividly after 9/11 how, you know, the DP administrator then, who was my former governor, you know, made all these statements about how everything was so great and, you know, there wasn't a problem from the air pollution, and then we got all the devastating impact later. So you have to be very careful about, you know, what representations we make as agency or elected officials when it comes to health impacts. Next, I would recognize the gentleman from Pennsylvania, Mr. Murphy.
Thank you, Mr. Chairman. Exhibit A, picture of a BP gas station. Some of you may have seen this in the media. I love the sign that they posted next to the tank. It says, next to warning, do not leave pumps unattended. You are responsible for spills. And so we are here today dealing with the same thing. Today on health effects. We've seen a lot of pictures of animals tragically affected by this catastrophic economic disaster, but let's not forget the human element. This committee recently passed legislation to provide health care monitoring for first responders, as the chairman just mentioned, from a national tragedy of a different kind, the 9/11 terrorist attack. Now we're dealing with a different sort, and one that we have to make sure that we are going to track and monitor for a long time. We have several things. One, the direct effects of the oil on residents, the indirect effects that also may come from food from the region and other products that may have been in the region and contaminated by the oil. Two, the effects of chemical dispersants, the 30,000 plus workers and volunteers, and now the President has ordered 17,000 soldiers into the area, who themselves may face increased risk because of their exposure to chemicals involved, including the oil. It is essential that this committee take a number of actions, such as calling upon the Department of Health and Human Services to immediately establish some studies and monitoring of those involved and exposed to these chemicals. Two, the Department of Defense also needs to take account of initial evaluations and monitoring of any soldier who's down there. Three, I believe we should be pushing for NIH to immediately move forward on establishing some longitudinal studies and to monitor those really over the next couple of decades. And of course, the Department of Agriculture is going to need to also monitor this as well. We do need baseline medical exams for anybody going to this region, and we need to establish those immediately. We need to get those on electronic medical records and track this. So much of what people are being exposed to, we simply do not know the medical effects. We also do not know the psychological effects, and it is important we monitor those as well. Although other hearings have received a lot of media attention because they have the CEOs of oil companies around, this hearing and this committee and this jurisdiction of health is critically important because this committee will be monitoring this issue for the next couple of decades. We will clean up the beaches. We will reestablish some of those areas. But we have to remember that the human toll of this is going to be long-standing. And it is important that the work we do today and the information received from this very astute panel is one that helps establish what we need to be doing in that direction. With that, I yield back, Mr. Chairman.
Thank you, Mr. Murphy. Yield to our full committee chairman, Mr. Waxman.
Thank you very much, Mr. Pallone. Thank you for holding today's hearing on the Department of Health and Human Services' critically important role in assessing the health effects of the Deepwater Horizon Oil Spill. It's been nearly 2 months since this tragedy took place, killed 11 people, injured 15 others. It's doing an enormous amount of damage to the environment and to the economy of people in the Gulf. Our committee has been very involved in oversight on this issue. Tomorrow we're going to hear directly from the BP CEO, Tony Hayward. Today's hearing, although is looking at a different aspect of the spill and underscores one reason why our focus is so comprehensive and so important. This oil spill has the potential to directly impact for years to come the health and well-being of millions of people who live and work in or near the Gulf area. I hope to get from our witnesses their examination of the potential health risks for cleanup workers, many of whom can no longer engage in their primary livelihoods, learn about how the spill may touch the broader population living near the Gulf, risks that may include respiratory complications, headaches, throat, eye irritation, rashes and skin problems, nausea, fatigue, and heat exhaustion. The possibility of more serious long-term illnesses has also been under study. We need to hear from people in the Department of Health and Human Services to assess these potential risks and address whatever health problems do materialize. They're working with each other in the different agencies, with other departments, with state and local governments, on surveillance mechanisms, food safety controls, worker training programs, epidemiological studies. Unfortunately, I suspect their efforts will be needed for a long time to come. Yesterday, in testimony before this subcommittee, Dr. Francis Collins, Director of the National Institutes of Health, committed $10 million for research on the health effects of the oil spill. This is exactly the type of initiative that needs to be undertaken now, and I commend NIH for its efforts. I know our own activities regarding this disaster will continue for as long as necessary and appropriate. Indeed, as the primary committee in the House for overseeing the Department of Health and Human Services, we're committed to ensuring that HHS lives up to its responsibility and most especially to its mandate to protect the public health. With that, Mr. Chairman, I thank you for the hearing. I thank the witnesses for testifying and being here today. I look forward to their testimony and working with them in the future.
Thank you, Chairman Waxman. Gentlewoman from Tennessee, Ms. Blackburn.
And welcome to all of you, and Mr. Chairman, thank you for the hearing, and I'm pleased that we're going to take some time and look at the potential health effects of the ongoing oil spill in the Gulf. It has, and having been down there to the Gulf, I know that it has greatly impacted the livelihoods and the health of workers, volunteers, and nearby communities that have not seen this type disaster before. We appreciate the significant effort by the agencies that are before us today to keep those involved safe through coordinated efforts focused on preventative measures such as worker training, seafood sampling, and closing hazardous waters. Everybody knows that we are seeing the 63,000 barrels a day going into the ocean, and there seems to be no reprieve, unfortunately, or resolution in sight. The fishing restrictions and a lack of tourism during the busiest time of year for this region is really devastating the economy, and it's changing livelihoods forever. It truly is a sad situation. Furthermore, the drilling moratorium in the region has only exacerbated the financial issues that families in this region are experiencing. And for many families, the moratorium has made it impossible to maintain the type lifestyle they had prior to the spill. That said, we must stay vigilant on this issue and monitor it closely, focusing not just on the physical health, but also the mental health. At this stage, immediate care must be sought and documented for all workers who become ill during the cleanup efforts. Going forward, the administration must work with all stakeholders to ensure that necessary safety measures are in place to protect the workers and the coastline communities. The spill isn't over, and we can't yet examine the lasting health effects, but the administration can take proactive steps to protect communities, public health, and workers throughout the course of the spill. I thank the chairman, and I yield back.
Thank you, Ms. Blackburn. Next, I would yield to our Chairman Emeritus, Mr. Dingell.
Mr. Chairman, I thank you for your courtesy. I commend you for holding this hearing. I ask unanimous consent that my excellent opening statement be included in the record for the reading of all who will, I'm sure, enjoy it much. Thank you.
Without objection, so ordered, and all the opening statements will be submitted for those who desire to enter them. Next is, we'll go to our, is she there? Is Lois? Lois is not there. Next is the gentlewoman from the Virgin Islands, Ms. Christensen.
Thank you, Mr. Chairman. And thank you, Chairman Pallone and Ranking Member Shimkus, for holding this hearing. There's some of us who have been asking over and over about the health effects of this disaster, and the answers have often been as unsatisfying as the prior promises of protection of the workers have been empty until recently. So we welcome this opportunity to discuss one aspect of the BP oil spill that has not gotten much public attention: the health effects and the actions that the U.S. Department of Health and Human Services has and plans to take. We've heard some of the health impacts that were the result of a similar but smaller, it turns out, catastrophic accident in Alaska just over 2 decades ago, as well as from others. But it still seems that the long-term effects are unclear. So I want to thank today's witnesses for joining us to provide an update on the efforts that each of your respective agencies is undertaking to help tackle this horrific disaster and protect the health and well-being not only of the workers, but residents in the affected communities. I hope that we will hear what experience your agencies might have had in the past with oil spills and what institutional memory remains that is informing your responses today. I also hope that we'll hear more coordination from you with this among yourselves and with state and local agencies than we have heard from other monitoring and responding agencies. We've already lost 11 lives that should not have been lost. We have to do everything we can to address the health needs of those they left behind, as well as the workers and residents of the area. As we know from Katrina and other natural assaults on the region, the Gulf area is home to many vulnerable population groups, and so I'm especially interested in hearing how the affected communities' most vulnerable residents, who likely already had under-addressed health and healthcare needs before the spill, factor into your outreach, your protection, and response. Again, I want to thank the witnesses for appearing and thank the Chair and Ranking Member for holding this hearing.
Thank you. Mr. Sarbanes?
Thank you, Mr. Chairman, for convening this meeting. There's so many different narratives that are unfolding here with respect to this catastrophe, and they're unfolding in stages. There was obviously the initial loss of life, the spill itself, which continues every minute of every day, the assault on the coast in terms of the effects on wildlife and the marshlands and the other impact, the underwater plumes, that's another narrative that's underway, the loss of industries, fishing, shrimping, tourism, and then, of course, the health effects, which is what we're here to speak of today. And all of these narratives, most of them, are potentially unending narratives. I mean, they're going to go on for decades and decades. It's really impossible to overstate the impact this catastrophe is going to have on our country. And we're really just at the very beginning of our understanding of all of the ramifications of this. But we do have to begin to build a record. We have to begin to try to understand what this is meaning. And that's part of what this hearing is designed to do. So I thank you for convening it, and I yield back.
Thank you. Gentleman from Georgia, Mr. Barrow. Gentleman waves. Next is the gentlewoman from Illinois, Ms. Schakowsky.
Thank you. The Oversight and Investigations Committee went down to Chalmette, Louisiana for a hearing, and we heard testimony from Wilma Subra from the Louisiana Environmental Action Network. And I wanted to tell you a little bit about her testimony if you hadn't seen it, about some of the problems with health. First of all, they hired a lot of the fishermen who are out of work, and initially they were required to sign an agreement that seriously compromised, I'm reading now from her, that seriously compromised their existing and future rights and potential legal claims. A judge felt that was overbroad, and BP entered into a stipulated judgment that removed that. But then this organization, a private organization, began distributing protective gear to the fishermen to utilize during cleanup activities, half-face respirators with organic cartridges, goggles, gloves, and sleeve protectors. She later said that they were encouraged not to use those. In fact, at one point, as I recall, she said in the Q&A that heat stress was the reason, and that I don't know if it was HHS or someone from the government or Louisiana agreed with that, and so they were afraid to use those respirators. And she said that fishermen were reluctant to report their health systems for fear that they would lose their jobs. And initially, their wives were expressing concern, but then they stopped speaking out, quote, for fear their husbands would lose their jobs. The Louisiana Department of Health and Hospital stated that, quote, oil cleanup workers, quote, should avoid skin contact and oral cavity or nasal passage exposure to oil spill products using appropriate clothing, respiratory protection, gloves, and boots. But she continued throughout her testimony to say that there was not the proper training, that equipment was in fact not provided. She says shrimpers have not been provided with the appropriate protective gear. The oily skimmers and pads are being pulled into the shrimp boats by the boat crews with bare hands and no protective gear. On May 26th, a number of workers became ill on the job, transported to the hospital. So we have lots of testimony now that these things are going on. The President said in his speech yesterday that 30,000 personnel were there, that he has authorized the deployment of 17,000 National Guard. Then there are volunteers who are working down there. I think we do have a tremendous responsibility to avoid the situation that followed 9/11, and there's every potential for that happening. So I'm very glad that you're here today. Looking forward to your testimony. Thank you.
Thank you. I yield to our Vice Chair, Ms. Capps.
Thank you, Mr. Chairman, for holding this hearing. While much focus has been on addressing BP's oil spill as an economic and environmental crisis, which it certainly is, I think it's incredibly important that you all and we all are here today to discuss the public health crisis that is unfolding in front of us. First off, I want to commend the Obama administration for the important life-saving public health response efforts that it has undertaken already. I think that your testimony today will show the many ways that your agencies are actively involved in the process. But reports of workers becoming ill from their involvement in the oil spill-up oil spill cleanup still persist. It's not only the workers who are suffering. The health of residents and, I fear, even tourists may be also affected long into the future due to contaminated beaches and shorelines. Cleanup workers, often local fishermen and shrimpers, are not formally trained to work with toxic chemicals and currently rely on BP for training and provision of necessary protective equipment. However, according to an internal Department of Labor memo, there's been a general systemic failure from BP to ensure the safety and health of the responders. And numerous media reports of minimal training from BP and photographs of workers without protective gear, this documents that these workers are not being protected. BP has made clear that they are incapable of making the protection of the public health their priority. It lacks the expertise, the resources, or incentives to really address the public health and worker safety issues resulting from this spill. That's why I've written to the Obama administration urging it to relieve BP of their role in the public health response and instead leverage the good work that you all are already doing to protect the public's health. One area I do feel needs to be addressed is the coordination of these efforts. There is a unique tragedy that we are experiencing now, and as such requires a unique multidisciplinary response to health protections. While you all represent the numerous departments within HHS responding to BP's spill, other agencies like OSHA, NOAA, and the EPA also have a role to play in protecting the health and safety of Gulf workers and communities. What is done now to protect the health and safety of workers and communities will have impacts long into the future. As a public health nurse who lived through the 1969 spill in Santa Barbara, I know that the damage wrought by an oil spill can continue to haunt the public's health. And while I hope that we hear more today about the work being done by HHS to protect these groups in the short term from acute health problems associated with exposure to oil and the dispersants and detergents used to clean it up, I hope we can also discuss what research can be done to learn from this disaster so that future generations can be better protected. I know you all would agree that nothing is more important than protecting the health of the oil spill workers in Gulf Coast communities. If BP will not take the necessary steps to protect the public's health, then the federal government must increase its coordinated efforts to protect the health and safety of oil spill workers and the Gulf communities. I know that you and your administration share this concern. I look forward to hearing your testimony and working with you to achieve this important goal. I yield back, Mr. Chairman.
Thank you, Ms. Camps. Gentlewoman from Florida, Ms. Castor.
Mr. Chairman, thank you very much for calling this hearing, and I want to thank our agency experts. You all have been very proactive, and we need your continued help. But I have to say that I'm very angry that we're at this point. I'm reflecting the frustration of my fellow Floridians and Gulf Coast residents who have been dealing with this BP disaster for weeks and weeks, and the anxiety that there is no end in sight. I have to say, Mr. Chairman, the BP disaster confirmed our worst fears about the risks associated with offshore oil drilling in and near places that rely upon tourism and fishing to drive our economies and our small businesses. I'm deeply concerned about the devastating impacts of the BP disaster, not just to Florida tourism and fishing, but also the potential health effects on workers and volunteer responders and people living in the Gulf communities. I'd like to thank President Obama and my colleagues here who have all been pressing BP to set aside a significant amount to address the economic and environmental impacts, because it was announced just a little while ago that BP will indeed put up $20 billion. The question is, will that fund include, give us the ability to address the physical harm to people and the public health? The taxpayers certainly should not be on the hook for this. I do appreciate FDA and NOAA releasing a statement on Monday about the efforts underway to ensure that the seafood from the Gulf is safe to eat, and notices that the public should not be concerned about seafood in the stores. And thank you also to CDC for announcing that tar balls washing up on Florida's panhandle beaches are not harmful. And by the way, you know, just a small part of the panhandle is suffering the effects of oil. The rest of Florida has pristine waters and is open for business, and we need you to continue with your vacations this summer. But the reality is that many families remain frightened and uncertain about what to believe. And there are conflicting stories in the news about the health effects of the disaster. Most experts state that brief contact with crude oil is not harmful. However, some other scientists say that evidence exists that many of the compounds in crude oil are dangerous. Toxicologists explain that cleanup workers, many of whom are out-of-work fishermen participating in the Vessels of Opportunity program, could face problems with breathing and coordination and increased risk of cancer. So give us the best data you have and tell us how we protect our hardworking folks. Furthermore, while EPA has directed BP to reduce dispersant application by 75%, we know that BP early on failed to use a less toxic dispersant, and 1.1 million gallons of Corexit have already gone into the Gulf of Mexico and is a threat to public health. What is the real story here, and what do we have to do to monitor it in the near term and in the long term? Because we know that Corexit does pose a human health risk and is even tied to lingering health concerns from the Exxon Valdez. So the people we represent deserve answers. We certainly can't rely on BP to put the public's health needs ahead of their business interests and corporate damage control. We need your help. We've got to make sure they've got the right protective gear and they're getting the best expert advice available. We're relying on you, and we're your partners in making sure this information is disseminated. So thank you very much.
Thank you. Gentleman from Arkansas, Mr. Ross.
Thank you, Mr. Chairman, for holding today's hearing to examine how the Department of Health and Human Services, HHS, is responding to the public health risk associated with the Deepwater Horizon Oil Spill, now the worst environmental disaster in our nation's history. I first want to express my continued frustration and disappointment that we are on day 58 of this environmental disaster, and BP still does not have a concrete plan to stop the leak or clean up the oil that has been gushing into the Gulf of Mexico for almost 2 months now. What we do know is that the nearly up to 60,000 barrels of oil a day that's being released every day into the Gulf is hurting and killing hundreds of thousands of species of animals. What we do know is that this disaster is destroying one of the most sensitive ecosystems in the world on which many people depend. What we don't yet know is the total extent of this damage. What we don't yet know is how this spill will affect the health and safety of the people who live and work in the Gulf Coast region, or those vigorously working to clean it up. We cannot properly move forward until we know how bad of a situation we're facing, and that's the point of today's hearing. Last night, President Obama announced that he will be directing BP to establish an independently administered account to help pay for the spill-related cleanup and economic damage claims. This is only one of many needed steps in moving forward towards addressing this terrible tragedy. There are many lessons and hopefully forthcoming solutions to be learned from this preventable disaster that started back in April. Sadly, the impact of this catastrophe is one that will ultimately need to be measured not in weeks and months, but in years. We must take this opportunity to not only examine our safety standards in deep water drilling, but to also examine how this spill is affecting both the short-term and long-term health of all those living and working in the affected region. I look forward today to discussing ways we can mitigate these harmful effects. I want to thank the witnesses who have come before the subcommittee today to testify about the efforts being taken by our government to evaluate and help those who are and will be physically, emotionally, and economically impacted by this disaster. Our government must do more to hold BP and other oil companies accountable for careless offshore drilling practices and the resulting harm they cause. We must ensure the most advanced technologies and safety procedures are in place so that we never face this situation again. Mr. Chairman, I yield back.
Thank you, Mr. Ross. Next is the gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman, for holding the hearing on HHS efforts to address the known and potential health effects of the BP oil spill in the Gulf. The Gulf of Mexico is in the midst of dealing with an incident that is tragedy like we've never seen, and my thoughts and prayers go out to the families and communities affected by this terrible accident. Energy and Commerce Committee has held several hearings in our Energy and Oversight and Investigation Subcommittee on the topic, and I believe it's crucial we begin to examine and prepare for the potential health effects of the oil spill in the Gulf. Today we are focused on how the spill might impact the local communities on the coast, as well as the workers who are working diligently to clean up the spill day in, day out. Approximately 13,000 cleanup workers are being employed by BP or its contractors, and more than 1,800 federal employees have been directly involved in cleanup operations over 4 states. The health and welfare of these affected communities and workers is a priority for me, and I know my colleagues on this committee, and I appreciate our looking into the issue today. I understand from the testimony we're here today that knowledge of the potential risk from the BP oil spill comes from scientific studies following the Exxon Valdez disaster in Alaska and other major oil spills around the world. The potential health risks are primarily due to inhaling toxic vapors, physical contact with the oil through skin or ingestion, and psychological stress in confronting the devastation. I appreciate our committee looking into this and hope that hearings will ensure that our government is doing everything in its power to protect the health of individuals who reside in the affected areas, and especially those who are directly involved in the cleanup. And again, Mr. Chairman, thank you for holding the hearing. I yield back my time.
Thank you, Mr. Green. I yield now to the gentlewoman from Ohio, Ms. Sutton.
Thank you, Mr. Chairman, and I appreciate you holding this hearing today. Everyone on this committee is familiar with the health effects that continue to afflict the first responders and others who were present at the World Trade Center on 9/11 and during the recovery operations there. Not long ago, this committee passed the 9/11 health bill to help those who were hurt. And we all remember it was the federal agency, the EPA, who said that the dust around the World Trade Center in the days after 9/11 was safe to breathe. Volunteers and workers were told it was safe to be at ground zero and that it was safe to work there. But we sadly know now that that was not true. We now know 9 years later that people who worked and lived near ground zero suffer from a variety of health problems ranging from respiratory illnesses to mental health disorders. And as we sit here today facing another tragedy, this one caused by BP, we must make sure that the mistakes that were made in the days and the weeks after September 11th are not made now. Every worker, every volunteer, every resident, and every person who comes in contact with this spill needs to be protected. We must act to ensure that they are safe to the best of our ability. BP's own documents, which are posted on the investigative journalism website ProPublica, show that between April 22nd and June 10th, 485 of their workers have been injured. Already, the Louisiana Department of Health is reporting 109 illnesses in spill workers after exposure to oil or dispersants. And sadly, there will be more to come. This oil spill is a tragedy on so many levels. And we must do all that we can to prevent the spill from damaging the public's health for years and years to come. I thank the witnesses for being here today, and I look forward to hearing about what HHS is doing to prevent a damaging outcome in the days and the years ahead. Thank you, and I yield back.
Thank you, Ms. Sutton. Next is the gentleman from Iowa, Mr. Braley.
Mr. Chairman, I'm glad we're having this hearing because it's a good opportunity to talk about the health impacts of the BP oil disaster on the responders, those living and working in the affected communities, and in our food chain. It's hard to recognize the true impact of this devastating release of oil until you've seen it with your own eyes and smelled it with your own ears. And back in Iowa, when I was growing up, and we didn't have a lot of entertainment, we'd have people come over to our house and we'd show them slides of things we've been doing in our lives. So I'm going to show you some slides of my trip last week to the Gulf Coast. This is a shot from Venice, Louisiana, at the mouth of the Mississippi River, which is vital to my state because it's the scene of the Southwest Passage where a lot of the grain that's produced in the Midwest enters the Gulf Stream of commerce. And those are ships that were leased by BP that used to be involved in the fishing industry. They're sitting there on a very rainy day. We went out in a cargo plane after our field hearing and had the opportunity to sit there with the end gate open and fly over miles and miles of the Delta and miles of open water with plumes of oil. And this shot is taken out the back, and you can see one of the relief vessels right there in the lower right-hand corner. And then this is a shot that shows you those plumes of oil on the water. You could also see little ribbons that look like underwater fire, which is where the dispersal chemicals were interacting with the oil below the surface. It literally looked like ribbons of fire. And this is another shot of the same plume. This is, again, flying right over where the relief wells are being drilled. You can see the drilling ship and the boom ships that are around it, and that's a more close-up shot. You can actually see the burn-off coming right off of the ship that's drilling the relief well. One of the things that I can't show you is the immense stench coming off the water with that hatch open from the oil coming off the surface of the Gulf of Mexico. That's what these relief workers and the people living in these communities are dealing with on a daily basis. That's a picture of the plane we flew in with the Admiral for the Coast Guard who was leading the response effort on the ground. This is a picture from our field hearing where we heard from two of the widows who lost their husbands when that Deepwater Horizon rig exploded. Fittingly, you'll see a picture of Andrew Jackson on a horse behind us because that's the same location where the Battle of New Orleans was fought. But this picture, to me, captures the challenge we face because no one appreciates the enormous mass of the Mississippi Delta when the Mississippi empties into the Gulf of Mexico. So you see some of the waterways that are part of the Delta. You see the enormous land mass that is interfacing with the water that's all exposed to this oil release. And that's why until you've flown those massive miles that are affected by this disaster, it's impossible to really comprehend what we're going to do to solve this problem. So I look forward to your testimony, and I look forward to working with you as we try to restore some sanity to what's going on in the Gulf of Mexico.
Thank you, Mr. Braley. I think that concludes our members' statements. And so we'll now turn to our witnesses, and I want to welcome our panel. Let me introduce each of them. On my left is Dr. Lisa Kaplowitz, who's Deputy Assistant Secretary for Policy of the Office of the Assistant Secretary for Preparedness and Response with HHS. And next to her is Dr. John Howard, Director of the National Institute of Occupational Safety and Health, the Centers for Disease Control and Prevention. And then we have Dr. Aubrey Miller, who is the Senior Medical Advisor for the National Institutes of Environmental Health Sciences with the National Institutes of Health. And finally is Mr. Michael Taylor, who is the Deputy Commissioner for Foods with the FDA. And I want to welcome all of you. Thank you for being here. You know, we have 5-minute opening statements, concur to the record, and then you may submit additional written comments afterwards if you'd like. We'll begin with Dr. Kaplowitz. Thank you for being here.
Thank you. Mr. Chairman.
I don't know if that's on. Is the green light on?
I have to move it closer.
Oh, yeah, move it closer. That works.
On.
Thanks.
Chairman Pallone, Ranking Member Shimkus, and distinguished members of the subcommittee, thank you for the opportunity to testify today about our public health and medical efforts in response to the Deepwater oil spill disaster. I commend this subcommittee for its leadership in holding today's hearing and share your sense of urgency on this important issue. On behalf of the Department, I would like to extend my sympathies to the families of those who lost their lives in this disaster, to those who were injured, and to those whose way of life has been changed for years to come. The impacts of this disaster must be considered in the time frame of not weeks and months, but years. Oil can remain toxic in the environment for many years, and we do not know the impact it could have on human health over the long term. As the agency responsible for coordinating HHS preparedness and response efforts, ASPR chairs a twice-weekly policy call with other HHS agencies involved in the Gulf response, including the NIH, CDC, FDA, ACF, SAMHSA, and other offices within HHS, as well as the Secretary's Chief of Staff. These calls assure that HHS response efforts are coordinated among all agencies and offices. ASPR also provided direct support and is providing direct support to the oil spill through the National Disaster Medical System. From the time of the announcement of the explosion and fire, ASPR's regional emergency coordinators in the Gulf Coast areas were in close communication with each state's emergency coordinator, the state departments of health, and the Association of State and Territorial Health Officials. HHS liaison officers deployed to the Unified Area Command Team in Robert, Louisiana, to the Incident Command Centers in Houma, Louisiana, and Mobile, Alabama, and to the National Incident Command Center at the U.S. Coast Guard headquarters in Washington, D.C. On May 31st, HHS, in coordination with the Louisiana Department of Health and Hospitals, set up a mobile medical unit in Venice, Louisiana, to provide triage and basic care for responders and residents concerned about health effects of the oil spill. The medical unit screens workers and citizens for exposure and refers those who require further care to local health care providers or hospitals. Our goal is to support the local community and fill in any gaps that may be there, not to displace local providers. As of today, the NDMS medical unit has seen over 140 patients since opening. Thus far, some patient conditions, such as heat stroke, have been consistent with any response effort in the area. In total, about 38% have been treated for acute respiratory conditions. Another 27-plus patient encounters have been for dermatologic, eye, or gastrointestinal problems, as well as a number of individuals who've been treated for injuries. The department is also directing attention and resources to address the behavioral health issues arising from the oil spill. Our experience and research from previous disasters, including the Exxon Valdez spill, allow us to anticipate and prepare for potential behavioral health needs, such as anxiety, depression, and other adverse emotional and psychological effects. To date, the Department's Substance Abuse and Mental Health Services Agency has engaged in supporting state and local efforts to assess and meet the behavioral health needs of residents of the Gulf states and workers responding to this environmental disaster. In addition, since the information available to inform decision-making related to the human health impacts is inconclusive, Secretary Sebelius has asked the Institute of Medicine to convene an independent panel of scientific experts at a public workshop exploring a broad range of health issues related to the oil spill, from heat exhaustion and other occupational hazards to exposure to oil and dispersants. This workshop will be next week on June 22nd and 23rd in New Orleans. In conclusion, I want to assure the subcommittee that our office, along with our sister agencies within the department and the administration as a whole, are taking the public health and medical consequences of the oil spill disaster very seriously and are implementing a comprehensive strategy to monitor and address any public health and medical issues that may arise. Thank you for the opportunity to testify today, and I'm happy to answer any questions.
Thank you, Dr. Kaplowitz. Dr. Howard?
Thank you, Mr. Chairman and Ranking Member Shimkus and other members of the committee. I'm here to provide you an update on CDC's activities in the Deepwater Horizon response. Following the fire and explosion on April 20th, CDC immediately activated its Emergency Response Center to coordinate response activities across the agency. CDC's National Center for Environmental Health leads the Incident Command and works closely with the National Institute for Occupational Safety and Health to respond to potential health threats to the public, workers, and volunteers from the disaster. As of today, CDC has 170 staff involved in the response, including 17 staff deployed to the Gulf Coast states. Throughout this response, CDC has been coordinating our efforts with other operating divisions of HHS and with the Coast Guard, OSHA, EPA, and most importantly with state health departments in the Gulf states. The response hazards that to the public primarily include skin and respiratory irritation to various chemicals contained in the crude oil and in the oil dispersants. Skin contact should be avoided, and any area that has come in contact with oil should be washed thoroughly. Eye, nose, and throat irritation can occur from closer contact with crude oil. Those with asthma or chronic lung disease may be more sensitive than others to very low levels of hydrocarbons, and even they and others can be sensitive to levels of hydrocarbons that are far below measurable levels. People who have questions about potential health effects related to the oil may visit our website for more information. We have information for residents, for professional healthcare professionals, for workers and volunteers. CDC, in partnership with state and local health departments, is tracking symptoms and health complaints that could be associated with the oil spill. Health surveillance of populations near the Gulf is being done through three mechanisms. First, we're collecting data from 60 poison control centers throughout the Gulf region. Second, we're collecting data from the BioSense surveillance system, which includes 86 healthcare facilities, clinical laboratories, hospital systems, ambulatory care centers throughout the area to detect any increase in illnesses or other health effects. Third, we're analyzing surveillance data that's being collected by state health departments in the Gulf, which are monitoring potential health effects related to the oil spill. We posted initial results from these collaborative surveillance activities on our website, and we update those routinely. CDC is also evaluating data from air, sediment, and water samples in the Gulf, looking for any indication of contaminants at levels that would pose a threat to public health. After EPA's public release of the chemical components of the dispersants being used in the response, CDC has completed a preliminary review of the toxicity of these dispersant components and has concluded that the substances of greatest concern to human health are being monitored by EPA. NIOSH is doing three major activities and is working together with the Occupational Safety and Health Administration. First, we're rostering all workers and volunteers included in the response by means of a voluntary questionnaire. To date, we've rostered 13,000 workers, and we hope to continue that process to get all of the workers and volunteers. Second, NIOSH is analyzing data from all sources for worker symptoms, health complaints, work-related injuries or illness incidents so that we can recommend interventions to prevent future injuries and illnesses. Third, NIOSH is conducting a health hazard evaluation of reported illnesses among workers involved in offshore cleanup operations as requested by BP on May 28th. Finally, as response activities proceed, CDC is working to protect the health and safety of workers, volunteers, and residents in the affected areas of the Gulf state. And as we learn more, we will update our recommendations. I thank you for your continued support and pleased to answer any questions you may have.
Thank you, Dr. Howard. Dr. Miller, you're next.
Thank you, Mr. Chairman, Ranking Member Shimkus, and the rest of the committee. Thank you for this opportunity to provide information about the activities undertaken by the National Institute of Environmental Health Sciences, NIEHS, in response to the oil spill disaster in the Gulf of Mexico. My name is Aubrey Miller. I'm Senior Medical Advisor to the Director of NIEHS and the National Toxicology Program. While extensive data exists on the effects of oil spills in wildlife and ecosystems, the effects on human health from these exposures have not been well studied. Experts agree that the potential for human health hazards exists since both crude oil and chemicals being used to fight the spill contain harmful substances. Yet understanding and quantifying these effects requires further study. A recent review article which looked at 34 publications concerning the health effects related to past tanker oil spills made clear that there is very little data concerning exposed individuals and only for a handful of these incidents. Historically, the workers involved in such cleanups have reported the highest levels of exposure and most acute symptoms. The reporting of higher levels of lower respiratory tract symptoms was observed in fishermen who participated in the cleanup following the Prestige tanker accident off the coast of Spain. A few studies have looked at psychological effects of spills, both among workers and in affected communities. Follow-up studies of affected populations from the Exxon Valdez spill, for example, reported higher levels of anxiety disorder, post-traumatic stress disorder, and depression. Such research findings remind us of the importance of keeping longer-term, less obvious sequelae in mind, not just the immediate toxicity effects, when considering the overall health impact of this type of disaster. Now turning our attention to the Gulf oil spill response. Our program director was on site within days of the platform explosion. NIEHS team have been continuous presence in Louisiana and have been working with the National Incident Command officials, as well as local and state officials, academic institutions, and other federal agencies to provide technical assistance for worker safety training related to the oil spill through NIEHS's Worker Training Education Program. The NIEHS Superfund Worker Training Program has provided safety training to emergency responders and hazardous materials workforce for the last 23 years. For other emergency responses, such as the World Trade Center attack and now the oil spill, NIEHS was able to provide nearly immediate assistance to help protect workers. 3 different levels of training for oil spill workers have been developed and supported by NIEHS. A 40-hour training course on hazardous waste operations and emergency response. A short 2- and 4-hour training courses on safety and health awareness, developed together with OSHA. And as of June 10th, BP reports that it has trained approximately 30,500 people using NIEHS worker safety training materials. Additionally, more than 5,000 pocket-sized booklets titled Safety and Health Awareness for Oil Spill Cleanup Workers have been distributed to instructors, safety officials, frontline responders, participants in the BP Vessels of Opportunity program, and beach workers in the Shoreline Cleanup Assessment Team. These booklets have been printed in English, Spanish, and Vietnamese. Here's an example of one right here. NIEHS has helped support and facilitate interagency coordination to protect the workers and the public affected by this disaster. To help assess the response to this oil spill crisis on June 1, NIEHS, in cooperation with the Coast Guard and BP, facilitated a multi-agency public health assessment of the oil spill responders in the Louisiana area to determine the need for any additional medical support and additional mobile medical units. In addition, NIEHS has helped form and is co-leading the interagency work group, the Interagency Oil Spill Health Monitoring Researchers Work Group. Within this work group, NIEHS has focused directly on identifying all the relevant human health and toxicological information to help inform our current actions and drive research efforts. 2, to develop new tools to gather information about the adverse health effects stemming from the oil spill, both in the short term and long term. And 3, engaging additional stakeholders to work with us in these efforts that produce the best processes, products, and outcomes. Lastly, NIH is exploring a variety of different funding mechanisms and programs to carry out important research related to this particular disaster and the people whose health may be affected. We expect a number of researchers to apply immediately for our time-sensitive awards, where proposals are accepted each month, reviewed, and funded within 3 months. And as you noted, Mr. Chairman, that NIH Director, Mr. Collins, has recently appropriated $10 million for additional research along these lines. These studies should prove useful information for some of our unanswered questions. One of the most important takeaway messages from our current and ongoing review of the science regarding human health effects of oil spill disasters is that there is a clear need for additional health monitoring and research to underpin our public health decisions. As the situation in the Gulf of Mexico continues to unfold, NIEHS will stay engaged, both as a committed partner in research on the health effects of these exposures on workers and the affected communities, and our efforts to keep cleanup workers safe. Thank you, and I'm happy to answer your questions.
Thank you, Dr. Miller. Mr. Taylor.
Good afternoon, Mr. Chairman, Ranking Member Shimkus, and other members of the committee. I appreciate the chance to talk today about FDA's activities with respect to the food safety aspects of the Gulf oil spill. FDA is an integral part of the federal government's comprehensive multi-agency program to protect the safety of seafood from the Gulf of Mexico. This program is important for consumers who need to know their food is untainted, and for the seafood industry, which needs to be able to sell its products with confidence. FDA is working closely with NOAA, the Environmental Protection Agency, our HHS colleagues here, and state authorities on a multi-pronged approach to ensure the safety of seafood from the Gulf of Mexico. The measures we are taking begin with the precautionary closure of fisheries and are backed up by surveillance and testing of seafood products and continued enforcement of FDA's hazard analysis and critical control points, or HACCP, regulations. FDA and NOAA are also working together to develop protocols for reopening closed fisheries in the Gulf in a manner that ensures the safety of product from those areas. Based on these protective measures and the best available science, we are confident that Gulf of Mexico seafood in the market today is safe to eat. The primary preventive measure for protecting the public from potentially contaminated seafood is, of course, the closure by NOAA of fishing areas in the Gulf that have been or are likely to be affected by the oil spill. NOAA acted swiftly after the spill to close affected waters, and NOAA has been able to stay ahead of the spill with its closures by anticipating the movement of the oil spill and by including 5-mile buffer zones around the affected areas. FDA is working closely with both NOAA and the states to ensure that appropriate closures are in place. To verify the effectiveness of the closures in protecting the safety of seafood, NOAA and FDA are collecting and testing a variety of types of seafood samples, including finfish, shrimp, crabs, and shellfish. FDA's sampling is taking place at Gulf Coast seafood processors and is targeting oysters, crabs, and shrimp, which could retain contaminants longer than finfish. This sampling will provide verification that the closures are working and that seafood on the market is safe to eat. As an extra measure of protection, to complement the closures and testing, FDA is stepping up inspections of seafood processors under our seafood HACCP regulation. HACCP is a system of preventive controls under which seafood processors are required to identify and control potential food safety hazards in their operations. We have just reissued existing guidance to Gulf Coast seafood processors explaining how they can meet their obligation under the HACCP regulation to ensure they are not receiving fish from waters that are closed by federal or state authorities. The agency will be inspecting these facilities to verify compliance. Finally, FDA and NOAA are working closely with states on a protocol for determining when closed waters can be reopened. Under the protocol, waters impacted by oil will not reopen until oil from the spill is no longer observable and seafood samples from the area successfully pass both sensory analysis by trained screeners and chemical analysis to verify that oil products are not present at harmful levels. NOAA and FDA will work to reopen previously closed areas as quickly as possible in order to minimize the impact of closures on fishermen and coastal communities while protecting public health. Mr. Chairman, we are all indebted to the scientists and frontline food safety specialists in our agencies and in state governments along the Gulf for their diligent and ongoing responses to this catastrophic oil spill. On their behalf, I appreciate the opportunity to discuss their activities with you, and I look forward to questions that you and the committee may have. Thank you.
Thank you, Mr. Taylor. And now that you've finished your statements, we'll turn to questions from the members, and I'll start with myself, and I'm going to start with Dr. Howard. Dr. Howard, we know that thousands of workers are participating in the recovery efforts to clean up the BP oil spill, and clearly your primary goal is to ensure worker safety and have an accurate record of where workers are stationed in the Gulf. Can you explain NIOSH's role in monitoring these response workers who are participating in the recovery through rostering? And I know that there's a difference between IDing workers through a roster as opposed to a registry. So I guess my question is, does this rostering contain enough information to follow up with people should a more detailed health registry become necessary? And just generally, what kind of outreach have you done to reach the largest number of workers, and how many have you been able to ID so far?
I think the simplest way to describe the difference between a rostering and registering, or between a roster and a registry, is that a roster is a list. It's a list of workers. A registry is active management of those workers in terms of assessing their exposure profile, the health effects that they may be feeling, and following them through time. So the first step in a registry may indeed be collecting the names and demographic information of workers that you would then put into a registry. So it's a foundational step. It's the first step that we're taking. So it does not ever preclude a registry from actually happening.
And what kind of outreach have you done to reach the workers, and how many have you been able to ID so far?
We've been able to roster nearly 13,000, and we do it in three ways. The first way that we started out a few weeks ago was by going to the actual sites where the workers are working. We're still doing that because we're not capturing everyone in the second method, which is as they come into a training center, before they're assigned for any cleanup work, we roster them at that time. There we are capturing nearly all of the workers who are coming in for training. Then the third method, which we're been asked by both other government agencies like Coast Guard and EPA and BP workers themselves, is if we could do some web-based rostering. So we're developing a program that they can go onto the web. So those are the three methods: going out and finding them ourselves, 2, rostering them in the training centers, and 3, web-based rostering.
And what other plans are there in the future to document health problems, either for workers or people in the community too?
Well, there's a lot going on in this area in terms of surveillance, looking at all of these systems that are in place now. I mentioned 3 different ways. One is through poison control centers. People call in. they complain or they ask information about a particular health issue. So we're looking at 60 poison control centers in the Gulf area, scanning all of their calls to see whether there's any oil-related issues. People complaining about eye, throat irritation, eye smell, hydrocarbon odors, etc. The BioSense program, which surveils healthcare facilities, then looks at what's the reason that somebody came into a healthcare facility. Was it because I had eye and throat irritation because I went to an area in which I was involved in cleanup, could be a worker, or I was a resident and I went to a beach area, for instance. In the third activity, we're looking at state health departments. Both Louisiana, Mississippi, Alabama, and Florida do an excellent job in their state health departments at collecting information about health complaints, people that are going to seek medical attention. And what's interesting about that lately is that we've seen about 400 or 500 calls if you add up all of those calls, and they're all on our website, on the CDC website. If you look at that, about 75% of them are coming from workers, only about 25% are coming from residents. So the proportion is obviously workers. There are, as you know, many millions of people who live in the Gulf area. So we're not seeing a large number of calls now, but we're monitoring. And what we're doing now is then looking at the types of information that we're getting, both from a call as well as an appearance in a healthcare facility, then comparing that to the 3 years previously as a way of looking at a baseline. Are we seeing more throat and eye irritation, more cough comes in? We're trying to compare the last 3 years to what we're seeing now.
Okay. I was going to maybe just quickly, Mr. Taylor, this idea with the FDA assessing whether the oil or the dispersants bioaccumulate in seafood, would you explain that to me? I mean, do the components of crude oil bioaccumulate in fish and other seafood, and do we need to be concerned about that in this, with this crisis?
Well, if fish are exposed to oil, it will be present. It can be bioconcentrated, bioaccumulate in the fish, in the edible portion of the fish, and this is why, of course, the primary preventive measure is to close waters and not take fish from waters that are contaminated with oil so they won't be so exposed. Dispersants, the compounds in dispersants are different. They're water soluble. They don't have the same ability to bioconcentrate, which is another important part of the analysis there. But again, the primary preventive is to keep fish that we're going to put in the marketplace away from, not take fish that are affected by the oil in the first place.
Okay, thank you. Mr. Shimkus?
Thank you, Mr. Chairman. Dr. Howard and Mr. Taylor, is the fish on our store shelves safe, or the seafood?
Well, I'm going to defer to...
Well, no, don't defer, because you have in your testimony, I think, a statement to that fact.
Yeah, I would say yes.
Thank you. Mr. Taylor?
No, we're confident about the safety, as I testified, of the seafood that's in the market, Mr. Shimkus.
Great. Thank you very much. Back to Dr. Howard. I understand that you're conducting health hazard evaluation reported illnesses, and you've been given medical reports for 7 previous hospitalized fishermen to assist in their evaluation. When do you think this evaluation will be complete?
Well, we certainly hope it's going to be complete by the beginning of next week, because we want to talk about it at the Institute of Medicine meeting in New Orleans.
Great. And this was a great discussion between the chairman and the difference between rostering and a registry, and I think that's an important line to continue to move down. First you have a roster, and then maybe that moves to a registry. How do you ensure that if you mentioned in your opening statement about people who might have asthma or chronic pulmonary activity, they would be more susceptible. So in this process, two things. How do you get an appropriate baseline of their health conditions prior to? And then how would you do a evaluation of if there's degradation in years based upon normal health decline or an impact on something like this?
I think the easiest answer would be comparison between the baseline that you've collected and then the assessment that you're doing after the exposure.
But you're going to have to get health data from their healthcare professional previous to this event.
And as Dr. Miller referred to in these previous studies, what has happened is questionnaires have been filled out by individuals who are workers or residents in these previous spills. And then you assess what their level of symptomatology was before, and then you assess it after the exposure.
So you're getting it from the person who may be ill and may be more ill, not a healthcare professional that does an evaluation of their health status.
No,
this is the same type of issue that we deal with in pre-existing conditions, on VA issues, healthcare issues. How do you identify this issue was based upon service duty or service connected or not?
Certainly, self-identified issues in a questionnaire have to be corroborated or should be corroborated in a better study with actual medical data, either a previous medical information that that individual's healthcare provider had in a previous record, so you want to look at that. And as it's been referred to before in the 9/11 situation, we have previous annual physicals from firefighters, so we have a baseline for them, and then we look at them post-exposure.
Great, thank you. And because you went on that line, do you currently run a program that provides treatment and monitoring of health conditions for first responders to the World Trade Center attack?
Yes,
Thank
our
you.
department.
Thank you. And my time's quick, so I'm going to continue to move. Dr. Miller, based upon what I've read, weatherized oil has lost most of its volatile organic compounds. What is happening to these?
The volatile organic compounds?
Right.
Yeah, they are evaporating off into the atmosphere.
So they are evaporating.
That's correct.
A lot of the testimony or the experiences we're citing is based upon like the Exxon Valdez or the Spanish tanker that broke up on this is different because it's a mile under the top of the ocean. There's a lot of pressure. Does pressure have a different characteristic that's making this do something different than just the evaluation of crude oil itself washing on the shore?
Well, I don't have any specific information of how the pressure affects it per se, but we are doing measurements, and EPA is doing measurements to actually see what's in the actual atmosphere. So part of it is this weathering process of the crude, and as it comes toward land or it moves around and is exposed to sunlight, et cetera, and gets to the atmosphere, then these volatile organics do come off, as well as some other compounds tend to break down in the weathering process as well.
And my last question, and my time's almost out. Could the oil and dispersant mix to form a compound that creates a unique human health risk that would not exist with just the oil or the dispersant alone?
Now, that's an area of uncertainty, and it's a potential concern for us. What is the effect of the oil and dispersant together? It could work two ways. One, it could lessen the effect, or it could also increase the effect, and that's something we need to look at.
Thank you, Mr. Chairman.
Thank you. Gentlewoman from California, Ms. Eshu, has 8 minutes.
Thank you, Mr. Chairman. I want to thank our witnesses for your expertise, for your testimony, and for the work that you're doing. Several news reports have stated that BP has told its workers that they don't need to use a respirator for the cleanup efforts, and the company is only releasing limited test results to tamper down public worries. So I'd like to start out by asking you if, in your opinion, do you believe that BP is doing everything it can to protect the health of the cleanup workers? Now, in our staff background notes, it's noted that there are over 13,000 cleanup workers that are employed by BP or its contractors. So this is a large group of people. So that's my first question. And my second, having to do with this, is have you been given access to BP's test results? And if so, could additional information from BP help you make more informed decisions? I don't know who wants to take this, but
I'd be happy to.
Okay, thank you.
Excellent questions. You know, I think that from the perspective of the data that we have, you know, oftentimes we don't know what we don't have.
That's what I'm asking.
That's the most serious issue. What I know we don't have, and we've asked BP for, is an actual list of the 13,000.
And when was that request made?
We made that request several times in the last couple of weeks.
And no response?
We have yet to receive it. So we're anxious to receive that because we would like to correlate it with our roster to make sure that we are capturing everybody. And for those folks that we do not have, we'd like to go out and find them so we can put them on the roster.
How many are rostered right now?
Right now, there are 13,000 rostered. We believe that
So
the denominator may be 15 or 20,000.
Wow. Does anyone else want to comment on that? On funding, we know that, the President announced today that there'll be an escrow account, that taxpayers will not pick up a dime of the costs of this catastrophe. Have any of you been reimbursed for your work so far?
Well,
or is it still nascent?
Secretary Sebelius wrote to the BP chairman saying that she expected all of our work in support of the response to be reimbursed.
Well, we all expect that. I just wondered if there's
we are
any
keeping
attempt
track
to
of it.
Reimburse.
We are
Okay.
keeping track.
Let us know when the check arrives. On the dispersants, oil is not obviously the only health concern. The manufacturer of Corset, the dispersant being used to clean up the oil, warns against contact with eyes, with skin, obviously the lungs. This product is somewhat volatile, and it's critical for cleanup workers and volunteers to wear personal protection equipment when applying the dispersant or working near where it's been applied. Can you tell us what steps you're taking to ensure that the dispersants will not pose a threat for the workers or the nearby communities?
From the health and safety perspective, we're not fans of dispersants. There was aerial spraying of dispersants up until about 2 to 3 weeks ago. That resulted or was correlated with the illness that the 9 fishermen had that we're investigating. Now, dispersant is only being applied, I'm to understand, in a subsurface manner. Okay, so aerial spraying really puts it in all sorts of exposure zones that we do not think is safe. So we're delighted that the application of dispersant is only subsurface.
Mm-hmm. And when it's subsurface, there isn't anything that reaches the surface, so there isn't any concern
Well,
there?
that's unclear. We really don't know. And certainly those workers that are operating at the source, where the oil and water column are coming up, mixed with dispersant, those workers may be at risk.
Are there any studies on human health effects of the dispersants that are being used now?
No, I think as Dr. Miller pointed out, we have very scant information in general about oil spills. It come from a few studies of oil tankers that have run aground. We have some information about acute irritant effects. Mm-hmm. We have some information about psychological stress in the communities. We have practically none about chronic effects.
Is there any such thing as a safe dispersant?
Well, you're talking to a health and safety director, and I'm not a fan of putting more hydrocarbons in an area that already has a lot of volatiles in it. Mm. I understand the reasons why they're being used, but from a health and safety perspective, I'm not.
Well, that's what we're here for today, to examine the health impacts. Does anyone else want to comment on that, Dr. Miller?
Yeah, and just kind of reiterating a little bit, because the effect of the dispersants, and we understand that they're trying to break up the oil and do things with it, but in terms of adding additional complexity and uncertainty for human health exposures and effects is more complicated, and certainly we need to be monitoring what these exposures may be, both at the source and then as it moves toward other human populations, to understand exactly what we're dealing with.
Thank you. Mr. Taylor, in your testimony, you stated that current science does not suggest that dispersants bioaccumulate in seafood. We had some discussion, I think, from previous questions about this. But NOAA is conducting studies to look at that issue. Do you know when those studies will be completed?
I don't have a precise timetable. I'm told it'll be a few months. They're doing a series of studies to really confirm what our hypothesis is and our understanding from the knowledge that we do have that these compounds do not bioaccumulate. We want to certainly confirm that. But but this will be a course of work over the next few months, as I understand it. I'd have to defer to them on the details.
Mm-hmm. Thank you. In terms of the chain of command, who covers for the President all of the various health aspects? Is it Secretary Sebelius that is part of the team and you all feed into or contribute your daily doings and what's happening on the ground?
We certainly all report to Secretary Sebelius. She's been very involved. As I said, her chief of staff has been at all our meetings. We actually we're just meeting with her today. The President is in charge and Admiral Allen is the incident commander. So we work through the incident commander. The Secretary is responsible for the health response.
It seems to me that there is, this is a very important aspect that is not being covered. And when I asked about the chain of command, I really don't hear, I don't think I've heard anything on TV that has either put out warnings or health reports, what people can access. I mean, maybe I'm missing it, but I haven't been aware of it, and that's why I'm, I raised the question. This is, I think it was, one of the members said, there are so many narratives to this. Without a question, this is the largest environmental disaster in the history of our country, and it's sickening. And I think anyone that sang that song, Drill Baby Drill, should have some second, third, and 10th thoughts about this. I want to thank you for what you're doing and what you will continue to do. I wish that this wasn't, I wish it were not the case that you are going to be busier and busier as a result of this catastrophe. But I think that the longest lasting effects are the ones that you are the ones that are going to be responsible to help take care of. So thank you, and thank you, Mr. Chairman.
Thank you. Next is Mr. Whitfield.
Thank you, Mr. Chairman. Thank you all for your testimony. To follow up a little bit on Ms. Eshu's line of questioning, when we had the CEOs of the major oil companies in here yesterday, I believe, they talked a lot about the unified command. And Dr. Capelet, you were talking about Secretary Sebelius and Admiral so-and-so and so-and-so, but what is your relationship to the unified command, and explain to us a little bit about the unified command?
Certainly. The incident commander is Admiral Allen. The two agencies that are jointly responsible for the response, in my understanding, are EPA and the Coast Guard. And certainly Secretary Napolitano is very involved since the Coast Guard is part of the Department of Homeland Security. We have representation in the National Incident Command Center, meaning HHS.
Can I interrupt you 1 minute? When you say incident command, is that the same thing as unified command?
Unified command implies there's more than one individual.
Yeah.
So I'm sure
you all refer to it as incident command. Yesterday they kept talking about unified command. But same thing.
It's the same structure, yes.
Okay.
It is. And we have representation in the National Incident Command Center, or the NIC, so that if any questions come up in terms of health issues, we are available. We're also available locally in the command sites within Louisiana and Alabama. There are state health officials that are involved in each of the states who also assist their governors, for example, in response in terms of state responsibilities. Part of the important aspect here is ongoing good communication among all aspects, but it is Admiral Allen who's responsible for the response.
But all of you represent agencies that are involved with the incident command.
Yes, sir.
Okay. Now, as far as these dispersants, Dr. Howard, I think you made it rather clear that you think the negative impact of dispersants would exceed any benefit by using the dispersants. So I'm assuming that if you had the authority, you would just say no dispersants at all.
No, I don't have that authority.
No, but if you did have that authority.
If I had that authority, I would say we have enough hydrocarbons in the exposure zone. And
but is EPA the agency that makes that decision?
I believe so.
Okay. And it's my understanding that they're still using dispersants, but that the EPA made them reduce by 25% what they started off using. Does that make sense?
My understanding is the aerial spraying of dispersant has ceased about 2 or 3 weeks ago, and now dispersant is only being applied subsurface as the crude oil column comes through the water column.
Okay. Now, when you have an event like this, obviously with your responsibilities, you try to anticipate what may be happening. And since we have very scant information from the impact of spills like this, I mean, you've indicated that we just have a few studies from tankers that have leaked, the Valdez tanker, others, so forth. But do we have any information at all? I have been told that the biggest spill that ever occurred from an oil well was in 1978 in the Gulf, which was referred to something like 1xCO2T1, and that there are 3.3 million barrels of oil that leaked out between June of 78 and March of 79. And I've been told that that was the biggest spill in the history of the country. Do any of you have any information at all from that spill?
If it was the biggest spill, it wasn't studied from the health perspective. If it was studied from the health perspective, nobody wrote it up and put it in the scientific literature.
Okay. Thank you. Thank you.
Would gentleman yield for his...
yield my point.
I just want to follow up quickly on this dispersant issue. The use of the dispersants are designed to push the oil not below the surface, but above the surface so it'll evaporate. And the dispersants is not something new that the issue here is the amount and using under and the pressure. It's what we use in everyday detergent. That's the same chemicals that we're using in dishwashing soap and stuff. That's what this dispersant is. And I think the issue for us is the amount, is the amount. I think that's what we need to focus on.
And there's one other attribute. The dispersant may contain a concentration of the surfactant that is found in dishwater, but at a much higher concentration.
Thank you. Ms. DeGette?
Thank you. I want to follow up on Mr. Whitfield's questions because my staff prepared a whole bunch of questions for me, which I'm going to submit, almost all of those for you to answer in writing. But what really strikes me is how it seems to me we're trying to do public health on the fly here because we don't have the data of how an oil spill like this, it's, we're resisting calling it a spill. It's such a catastrophe, will impact public health. And what strikes me is in all of your written testimony and then your verbal testimony today, you're talking about putting together the worker monitoring, you're putting together the different lists and so on. But what I want to know is, do we have enough data to tell people about the potential health risks and to warn them about what they should or shouldn't be doing? I'm wondering if anybody can answer that question. Yes, Dr.
Well, I'll start. First of all, you're absolutely right. We don't have enough information. I wouldn't say we're doing public health on the fly. I've been in public health for many years. We know how to do monitoring, how to do surveillance, how to work with the health system.
That's just great. And I'm glad you're monitoring and you're surveying. But my question is, let me just, Dr. K, and I'm not meaning to be critical of you, but But when we were down there last week, we were talking to folks who were concerned they didn't know what to do. We were talking to workers who were saying, we're being told by OSHA to wear breathing masks, and then we're being told by BP that the risk of heat exhaustion is such that we shouldn't wear the breathing masks, and they didn't know what to do. But then we received an email. We received actually a bunch of emails from Dr. Gina Solomon's blog, which talked about, she's of the National Resources Defense Council, and yeah, she testified, and about people who don't know what to do, not just the workers, although we're hearing concerns from the workers. This one gal said, I'm pregnant and concerned about the health of my unborn baby. We live about a half a mile from the Mississippi Gulf Coast. I'm concerned about the fumes that my family is breathing. Do you have any more info on this or other areas to find info on it? You said miscarriage is possible for pregnant women. What stages would this be? All stages or up to a certain trimester? I also have 2 children under 5 that I'm concerned about the impact on their development. I am seriously considering leaving the area. Do we know what to tell people like this, and are we telling that to them?
Well, they don't have anything.
First of all, there's a great deal we don't know, and that's exactly why we're having the Institute of Medicine do the workshop next week. We're very concerned about vulnerable populations, and we've asked experts. The Institute of Medicine has brought in experts addressing these issues with children, with pregnant women. We know they're vulnerable to many exposures.
So, yeah.
We don't know in this case.
But here's the thing, and I think this is a great opportunity for us to get more data, but we're hoping on the other end that we'll put regulations in place and supervision so that we don't have oil spills like this. So we'll get the data for the next one. But my question is, so you're bringing the Institute of Medicine, you're bringing everybody in, that's great, but what are we going to tell this gal? What are we going to tell everybody else to do? Because it does no good to just collect the data if we don't have something to tell them. Like Mr. Taylor saying, you know, we know what we're going to do with the fish. We're going to tell people not to fish there and not put those fish on the market. What are we going to tell these people who live along the Gulf Coast, or the people who are the fishermen, or the people who are helping remediate it? What are we going to tell them to do, and when?
At CDC, we have a website that has information about food, about smell, about swimming, about water, about drinking.
Yeah, okay, so if people smell the oil, what are we telling them to do from a public health
Well,
perspective?
odors, some people are very sensitive to odors, and obviously we'd like people to, avoid if they're in an area in which there's a lot of odors, and certainly in workers' populations, they could be in those areas
Okay,
at work.
but like if people are smelling bad odors, that's because there's some substance in the air, probably oil, that smells. Do we have some knowledge or sense that might have some adverse effect, and maybe tell them to stay indoors? Or I don't know.
That's exactly what I just said.
Okay.
About trying to avoid it. I think we should point out that the human olfactory nerve at the top of our nose is probably the most sensitive measure of hydrocarbons that we can have. A lot of the instruments that we use that find undetectable levels that we measure often are not as sensitive as our nose. So the nose is extremely important. If you smell hydrocarbon, try to get away from that area, go inside.
And have we told that to people?
The gentlewoman's time has expired.
I apologize.
That's
I'm going to ask you all to supplement your answers, because I think these are really important questions.
Any written questions you'd like to submit? Sure. All right. We'll follow up. I should mention to you that, you will obviously receive written questions. We try to get them to you within the next 10 days or so. Next is our ranking member, Mr. Barton.
Thank you, Chairman Pallone. And I apologize if I ask a question that's already been asked, since I've just now gotten here. Yesterday, when we had the CEOs of the major oil companies, I asked them a question, and they weren't very definitive. So I'm going to ask you folks the same question. Is there any capability now to put some of these organisms into the oil spill that convert it to non-toxic substances? Some of the people have talked about some sort of organism from algae or some of these activities like that, is that advanced enough that we could use that to convert the oil into something that didn't have any kind of a long-term health liability?
I'll just say that, we represent the Department of Health and Human Services, so we're experts in human health, and so that may be something that may be more an environmental or other issue.
Right. I believe EPA was working on remediation efforts and using biologics to try to help with remediation, so we could probably...
Y'all aren't aware of any of that activity yourself? And I'm not saying you should be. I'm
not specific.
This is a health hearing, so I'm asking a health question.
I think we've read the same reports that you've read, but we're certainly not experts in that area.
All right. Really, that's the only question I had, Mr. Chairman, and so I'm going to yield back. But thank you for I think this is a good hearing. I would ask the chairman a question. Why do we not have the EPA here? Could they not come, or you didn't want them to come, or?
You're asking a difficult question.
I'm not intending to.
Delves into the realm of jurisdiction of the subcommittees.
Huh. Okay, well, that's a fair answer. Thank you.
Okay. Next is the gentlewoman from California, our vice chair.
Thank you, Mr. Chairman, and thank you all for your testimony. It's really helpful to hear the important steps that the Department is taking to protect the health and safety of both now and in the future. You've all described how your agencies work in cooperation with each other. If you sense a certain frustration with us, it's because we sense that there might have been, and this is what they're going to drive the series of questions that I hope to elicit some responses from you. Before I do, I just want to say at the outset, you are doing incredibly important work and necessary work. We need to learn lessons. If there isn't enough data, we need to start creating data now. And I understand that from Dr. Francis Collins, who spoke who addressed another of our subcommittees, or this subcommittee yesterday. We need to develop a coordinated health system to respond to any disaster in the future, whether it's like this one, whether it's natural, whether it's man-made, so that we can ensure the health and safety of both responders and local communities and in any future tragedy. And this is not something that you haven't thought about as well. So I want to get some responses from you about how we can well, let me just phrase it this way. Last week at a hearing, environmental health experts agreed that enhanced federal coordination was needed to best respond to this disaster. And that being said, you work in under one cabinet secretary. We know that some of this public health response is being done outside of HHS and OSHA and NOAA, and there's presence at the Gulf now by these other agencies as well. So I have written, I'll just say as a disclaimer, I've written a letter to the President cognizant that BP is not capable of dealing with this. They have not demonstrated their ability to deal with the public health of their workforce and the others that they've employed to help clean up the disaster. So I've said take it out from their responsibility. I've suggested to the President and create kind of a head coordinator or a czar, if that's a word that appeals to you. I want to know, that's behind some of the questions I'm asking you. If you get me some specifics, each of you briefly, of the ways that you and your department have coordinated outside HHS with some other federal agencies, and in a very short answer, if you could.
I'm actually glad to answer that because I was on the phone today with the head of OSHA. OSHA actually has joined our call, even though HHS, they're very important. We've been in meetings with EPA. I know my colleagues have coordinated with NOAA because of the whole issue of fish. There has been a great deal of discussion cross-department.
Okay.
Another piece that I just want to say briefly is the role of the state and localities is very important.
That was another concern I had. Are you able to work down that
Absolutely. We have close coordination. I was also in communication with state health
officials.
Let me drive it one step further. What's your relationship with BP or your people on the ground as you're dealing with them?
I'll do my best.
Yeah.
Our communication with BP has been through Incident Command.
They have a
It
link
is
command?
through the Coast Guard.
Oh.
We want to work through the appropriate channels.
Okay.
I know that there are many discussions in terms of the payment issue, but we really try to coordinate, including our discussions with BP. So I don't know if any of my colleagues want to answer, but we work through Incident Command.
That was great response. I'm going to ask one final question, but I'd like to have anybody else pick up on this if this seems an appropriate topic for you to explore.
Well, just that on the food safety aspect of this, our collaboration with NOAA and the states has just been central. We're working towards really common.
So you already
approaches
do that.
for
You're
closing
doing
both
it.
state and federal waters. It's a seamless, coordinated effort on the seafood safety side.
Okay.
I can add additional comment too. So with regard to our worker education training program that we went down and tried to help develop content. But
Is this with BP?
This was actually, BP is the one who implements it, but it was developed with OSHA, using our Coast Guard and Incident Command in general as a throughput and developing this. So BP could start to develop this and use it for the workers that are
Can you
down there.
guarantee that they're actually doing it? Do you have a way of doing that as well?
We don't have that from our particular agency, but OSHA, who we work with, and NIOSH
They
also,
would then.
they would have additional oversight and opportunity to evaluate the actual implementation of that. We also have an interagency work group now that's working on the surveillance issues and some of the health, longitudinal and short-term health issues.
Let me see if I can get an answer. I'm being rude. I'm sorry. We tend to sometimes do that. At least I would like to, and my time's out. I'd love to have one other response if I could. And maybe you don't feel comfortable saying this. Do you see a need for a little bit more coordination than you're able to get it because of the urgency on the ground there? Would that be an idea that should be pursued, that I should keep bugging people about, having a chief coordinator, if you will, or someone to organize? I find it hard to know who to turn to.
Actually, I came from the state and the local perspective. I've only been in my position 3 months. I think that things are being very well coordinated at all levels, up and down and across government, and using Incident Command is really the best approach to take. It gives us a sense of who's in charge. There's been an incredible amount of communication cross-department.
And so so Admiral Allen is the incident commander, right? And so you believe that is and you all feel, can I get a real quick assessment from each of you? Is that working? Do you feel like having that one point person should be the way it continues? Just kind of a yes or no quick.
The system's working well in terms of.
You feel it is working well?
From an FDA standpoint, food safety standpoint, I think the system's working very well.
And from NIEHS, we can coordinate through the department and back up. So we haven't seen a problem with respect to that.
Okay.
I would say one of the issues that we want our committee to look at next week is whether or not we have sufficient coordination.
What committee is that?
Our Institute of Medicine committee meeting in New Orleans.
So you're going to bring this
One
up
of
with
the questions that we want them, are we coordinated enough?
Well, I'll be interested. Will that be okay? I'll look for that answer then from them. Thank you very much.
And our issues are still getting at data and things like that would help NIOSH and us perform the research that we need. So that needs to get translated back to BP.
Thank you.
I can tell you one panel includes federal, state, local. It's going to be a whole discussion of that aspect of coordination.
Great. Thank you very much.
Ms. Christensen.
Thank you, Mr. Chairman, and I'd like to thank all of the witnesses for the work that you're doing. It's really appalling, the lack of information on health impacts that we've not been able to accumulate over the years. But I hope we never have another spill like this, but I hope that the work that's being done now, should it happen, we would be better prepared. A question following up on Ms. Kapp's question, within the health department, who's in charge? Within the Department of Health and Human Services, within the Department of Health and Human Services, Secretary Sebelius is in charge. She's not on the ground. I will say my boss is the Assistant Secretary for Preparedness and Response and is the chief advisor to the Secretary on emergency response issues.
And that's
coordinates
Dr.
the
Laurie.
rest of the team?
Exactly, and that's why I'm here. We do take this very, very seriously. We're in constant communication with the Secretary's office, and, she is in charge.
Okay, but even within the different agencies, with so many agencies operating, it's really, you still need
We have twice-a-week calls.
Okay.
They're chaired by Dr. Laurie. Dr. Laurie was on leave. I chaired them.
Okay.
We've pulled together all components of HHS, including CMS, because of whole issues about healthcare payment issues, everything you can imagine, Agency for Children and Families. So everybody, every component of HHS has been either in the room or on that call, and it has worked very well in terms of coordinating our efforts.
Another question, I guess, would go to, I'm not sure who it would go to. It might go to Dr. Howard from Centers for Disease Control. In response to another question about the information that's being shared with the population about what to look for and how to respond, you talked about it being on the website. The population, a large part of the population that we're dealing with in the Gulf region don't have access to a website.
Right.
So what other avenues are you using to reach some of the harder to reach people?
We're using every avenue that we can get our hands on, including the local and the state health departments.
What about radio?
Radio, TV, we're Twittering, we're using all social media that we can get our hands on.
And for the public meeting, the IOM meeting, again, are all media being used to reach out? If the public is invited, we want the public to know about it.
That's an excellent point. We're well aware this is a very diverse population, very culturally diverse, and that is one additional charge we've given to the IOM. We want to have addressed at this meeting the best way to reach out and to communicate with the range of populations, and we hope for some very good feedback from them.
Okay. A recent study, apparently, of beach cleanup workers and volunteers after an oil spill in Spain reported increase in DNA damage. And I believe it's been reported in some of the other spill workers from some of the other cleanup of oil spills. Do we have any idea what the effects of those changes to DNA or the genetic makeup might be? And are we planning to follow up on what we have seen with the workers and volunteers in this spill?
We've actually, as part of our interagency group as well, have connected with the research group from Spain and are evaluating not only their materials, but we'll be working with them closely to look at some of the results as well to help inform us. And this will go also before the IOM and the direction in which we develop research. So how does this help us think this through? What tests do we need to do? And what are our concerns based on those findings?
I don't remember that there was any finding from the Exxon Valdez workers and volunteers. Any thought about going back and checking them? Or is
there's been some follow-up of limited populations, but not in the scope that there should be.
Is this damage to DNA considered serious, or is it something that is felt can repair itself?
I'm not totally familiar with all the tests, but the tests certainly indicate that there may be a problem that's happening based on the exposure. So what they were looking at is the groups that had higher exposure and lower exposure, and did these changes occur. So the ultimate ramifications in terms of public health or disease is not known at this point, but certainly it's a cause for concern, and to look more closely at that particular issue.
Gentlewoman.
Thank you.
Thank you. I'm just so you know, we're expecting to have votes soon, so I'm trying to get everybody in before. The next member is Ms. Castor.
Thank you, Mr. Chairman. Mr. Taylor, the FDA's recent announcement says the public should not be concerned about the safety of seafood in stores at this time, but There are large areas of the Gulf of Mexico closed down. You know, here's the most recent map, and it's really having a terrible impact on all of our commercial fishermen and our charters, so many small businesses. But I think it's important to also emphasize there are large areas still open for fishing. You know, you can come right off of Tampa Bay and get the reef fish, grouper and snapper. It's fabulous. So you all are monitoring. You're working with NOAA on these closures, and I wonder if you would go through your jurisdiction and then explain some of the sampling that's going on as well. I know that's primarily NOAA's jurisdiction, but if you would explain that and then tell us how you're working with states to ensure that the areas are reopened on a timely basis.
There is a shared jurisdiction over all of this between FDA, NOAA, and the states. With respect to closing waters, federal waters, that is from 3 miles offshore and out, that's NOAA's jurisdiction over federal waters. The states have the authority to close the close-in state waters. And, of course, NOAA and the states...
3 miles?
3 miles out to the, yes. NOAA and the states work very closely on that, and we're in consultation as well with NOAA and the states about the closure of waters. So we're confident collectively that these are ahead of the spill, they're protective, and they're ensuring that seafood that is then harvested and brought to market, you know, has been taken outside of these closed areas, and we've got that fundamental preventive measure in place to give us confidence. But then, yes, we're doing surveillance sampling of fish that is coming to market. NOAA and FDA are doing that sampling, again, just to verify, you know, that protective measure is working. And so it's very much a shared
How does that
enterprise.
take place?
Well, it's various ways in which the sampling is done. NOAA is collecting samples out, you know, in the water, in the vicinity of the spill, and just again being sure that our understanding of the protectiveness of the closure is, you know, verified. We're collecting samples at retail, at processing establishments, I should say, where the fish has been brought to be processed to go to retail. And so again, that's where we're looking at crabs and shrimp and shellfish. So again, it's a collective, coordinated effort to provide a verification that the system's working.
And then on the reopening, I want to make sure I understand the criteria for reopening. You mentioned that you and other agencies have looked at baseline levels of oil contaminants in seafood from the Gulf. While this spill is obviously very severe, there's been a lot of drilling in the past and spills of petroleum product.
Right.
Are the baseline levels of petroleum-related contaminants in seafood in the Gulf of concern to the FDA?
The baseline levels are not of concern, and in fact, they are well below what would be our level of concern from a public health or safety standpoint. And so we're developing a protocol for reopening that would look at the levels that are of concern and be sure that any residues are below those levels of concern. So, you know, we expect over time levels will go back to baseline, but baseline is way below.
And if it turns out that the baseline levels are well within the safe range, will you wait until the levels return to the baseline before NOAA reopens federal?
No, we don't think public health requires waiting until we go all the way back to baseline. Again, based on our safety evaluation and our risk assessment, we can set levels that, you know, where the level of concern actually is, and then be sure that any levels are below that. So we don't need to wait until we go all the way to baseline.
Okay. We had a researcher at the University of South Florida where they have a great consortium of all the public and private universities in Florida, and they've just gotten some grant money from BP, thankfully, because they've been out on the water with their vessels, and the taxpayers really should not be paying for their research, and they're one of the partners for NOAA. And one of the researchers had difficulty getting a water sample, an oil sample from BP. Have you all run into any of that, any resistance from BP getting oil samples, water samples, or air samples?
Yeah. I'm not aware of it from FDA's vantage point. I would check, though, and be sure, but I haven't heard those reports as far as FDA is concerned.
Okay.
We wanted to acquire some dispersant to study it. The manufacturer is under contract to BP to sell all of their product to BP. So we went to BP to see whether or not they would allow us to purchase some, and we received that assurance from BP through its manufacturer that we would be able to look at getting some so we could study.
What's their time frame?
The time frame for getting that permission?
Or getting the actual sample?
Well, we're still waiting for it, but we're hopeful.
Gentlewoman's time has expired. I'm just trying to move along because I know we're going to have votes soon. Gentleman from Iowa, Mr. Braley.
Thank you, Mr. Chairman. I'd like to start with some brief comments about terminology. Some of you used the word spill in your presentations. This is a spill. BP, from the beginning, has misled us about the volume of spill coming from the Gulf. And I want to talk about that because it relates to the whole problem of planning from a public health standpoint. The day after this release occurred, we were told that no more than 1,000 barrels per day were coming out of that wellhead. On April 27th, an outside group looking at the video monitor upgraded that estimate to 5,000 barrels per day, which BP contested. Then last week, or the end of May, that estimate was raised upward from 12,000 to 19,000 barrels per day. And then just this week, we've been told that the release after the intervention occurred can be as great as 60,000 barrels per day. That is 2.5 million gallons per day, 17.6 million gallons per week, 75 million gallons per month, and over the 57 days of this disaster, which is what it really is, it's 144 million gallons. And my friend Mr. Whitfield talked about this Ixtoc 1 release in Mexico. It wasn't in the United States or the continental shelf, which was termed the largest accidental disaster in history of 100 to 140 million gallons. We will exceed or have exceeded that flow rate. So when we use the word spill, talking about that massive amount of release, it does a great disservice to the people whose lives have been impacted by this disaster. And Dr. Howard, you mentioned that you were not a big fan of dispersants, and having spoken to people on the ground who were involved in those decisions, I mean, one of the problems we have is we're talking about balancing environmental and public health interests. People who made that decision did so reluctantly, talking to them, because managing this immense quantity of oil from an environmental and ecologic standpoint is a totally separate challenge than dealing with the public health implications. Isn't that true?
Yes.
And, so you talk to the people in the Gulf, and they talk about this enormous water column at the site of the release and the trillions of gallons of water that are being used where these chemical dispersants are dissipating in some way these large plumes and slicks of oil. But the reality is you're making tough decisions about trade-offs between how you clean this mess up and how it impacts the long-term commercial fishing industry and vacation industry, and then the implications for public health from the workers who are exposed to it. So I'd like all of you, if you would, to comment about how you're struggling from a public health standpoint with dealing with decisions that have to be made that could be not in the best interest of public health, but have very significant implications for environment and ecology. So
I would say that what I would like is for when those decisions are discussed and made, that a consideration at that time be placed on that same table for public health, both from the resident standpoint and from the worker standpoint. So all I would ask is, as those very tough decisions are being made, talk about, factor in the public health issue. That's all I would ask.
Dr. Miller?
Yeah. And additionally, in terms of the toxicology or what might come with this, so if we don't know something, that we put into place structure to get the information we need, so we can make better decisions, we can understand the effects of what our actions are.
Dr. Kaplitz?
Just to add to that, public health is at a disadvantage precisely because we don't know. if we had the data, it would be easier to present the risks. And since we don't know what they are, it makes it very, very difficult to counter some of the decisions that are being made.
Mr. Taylor?
Well, I think our approach to food safety very much takes account of both sides of the coin. I think it's our being protective and preventive of seafood being taken from the contaminated waters is what permits us to say that product on the market is safe. And so protecting the fisheries that are safe from the public confidence concern that would arise if we didn't have a good protective system in place for the seafood that's potentially contaminated. So I think inherently our food safety approach is taking account of both sides of that coin.
Well, I think you've done a nice job of laying out the toxic components of sweet crude and some of the disbursements and how they interact. But when you don't know the total volume of this release and how that combined effect can contribute to these public health considerations, I think we're all at a disadvantage, and I think we need to get to the bottom of that as well, and I yield back my time.
Thank you, Mr. Braley. The chairman of the Energy and Environment Subcommittee has joined us, and I would yield to him. Mr. Markey.
I thank the gentleman very much. Dr. Howard, in your written testimony, you state that there may not be a health risk just because residents and workers smell toxic chemicals, because these chemicals can be smelled at levels, quote, well below those that would make most people sick. Last week, in a hearing here to examine environmental fate and human exposure to oil and dispersants. At that hearing, one of the witnesses said that she believed that it was inappropriate to not warn people that they could be made sick. This witness named several chemicals found in oil, including benzene and toluene, which are hazardous to human health at levels far below the odor threshold. Dr. Howard, would you agree that some chemicals present in crude oil may be hazardous to health at levels below where they can be smelled, and that assuring people that they are safe when they smell these chemicals may not be appropriate?
Yes, I would agree.
Is it possible that these fumes can cause long-term health impacts long beyond when the symptoms of eye, nose, throat, and skin irritation pass?
It certainly is possible. We don't have any data to refute that.
Do you think if people smell these fumes, should they go inside to reduce their exposure?
Yes.
If these fumes come into the home, should people close their windows to reduce their exposure?
Yes.
Dr. Miller, do you believe that there should be a centralized federal agency responsible for compiling all the health information and surveillance data related to the BP Gulf oil disaster?
It needs to be done. I don't know what the best agency to do it is in terms of that, but it needs to be done in a research component.
Which agency, in your opinion, should hold that responsibility?
Well, through HHS, probably a shared collective response with regard to that.
How would you then share that information with university and other independent non-governmental scientists?
If it's developed accordingly, they should be stakeholders in the actual development up front and participate in the way it's implemented.
Okay, the CDC website says that smelling chemicals isn't a risk. Should that be rephrased on the CDC website?
I think for most people, but there are people who are very sensitive to odors, and I think that would be something that we are looking at.
Is it phrased that way on?
No, that's an area that we've received a number of surveillance reports, and we're looking at that phraseology right now.
Okay, so you believe that perhaps the warning should be more clear for those that might be vulnerable?
Exactly. There are people who are very sensitive to hydrocarbon odors.
And how long would it take in order to ensure that we have a warning that reflects the level of risk for people who could be vulnerable?
Well, soon, very soon.
Very soon.
We hope to be able to finish that this week and to have the language on the website.
So by Friday?
Hopefully. Yes, sir.
We'd hope that you'd be able to finish it by then. And one final question, is BP
sharing all the information that you want with regard to the health effects?
You know, I had answered that question earlier. The answer for us in NIOSH is no. We have asked for a list of workers that they have hired, specifically by name, so we could correlate with our roster. We have yet to receive that list from them.
Dr. Miller?
We have not specifically asked BP for anything at this point, but we will be looking more toward that as we develop the research.
Okay, but NIOSH, you have been asking, and they have not been fully cooperative.
Yes, sir.
Is there any reason why BP would withhold health-related information, since it would make it possible to put together the best response to protect the health of people in the Gulf?
I wouldn't speculate on that.
I would add one thing just for our worker education training program. They have been very compliant in working with us with respect to trying to provide information to workers.
On that program, but I'm more concerned about about what I'm hearing from Dr. Howard. I would say that BP continues to be more interested in its own liability than it is in the livability for the people in the Gulf. They should make the health of these residents paramount. They are responsible for the harm that's going to be done. They should ensure that the information is in the hands of public health officials so that they can do their job and protect them, and they should do it immediately. Thank you all for your testimony. Thank you, Mr. Chairman.
Thank you. And that concludes all questioning, just in time for votes. So I just want to remind members that they can submit additional questions for the record. Some have already suggested that they would, and would like to get those to the clerk within the next 10 days, and then we'll send them to your various offices for the panel. And again, I want to thank you for being here today. Obviously, this was very important, very informative. We may have to do additional, hearings like this. We'll see as we progress. But I thought this was very enlightening. Thank you. And without objection, do you have a? Without objection, this meeting, the subcommittee is adjourned. Thank you.